I am Dr. Vishnu S Reddy. Acute sinusitis usually is a beginning, nasal discharge, nasal congestion, and heaviness of the face and facial pain, and this usually lasts for about 3 to 5 days. So generally it may subside in 3 to 5 days, and if it continues to 10 days or so, then there will be added bacterial infection where the mucus discharge will become thick green yellow discharge, and then nasal blockage, dry cough, and along with the other symptoms of diminished sense of smell. If it exceeds beyond 10 days, then that means the sinuses are involved and it is becoming sinusitis also, not only rhinitis. The infection in the sinuses have caused these thick green yellow nasal discharge, post-nasal discharge, dry cough and headaches. So if these symptoms are recurring again and again, then it will lead into the chronic sinusitis, particularly when there are associated factors like nasal septal deviation and other allergic rhinitis, and sometimes it may be because of the dental infections also. These symptoms will turn into chronic sinusitis. The treatment for acute sinusitis usually warm or lukewarm saline nasal washes or nasal douching. You can prepare yourselves with some salt water and sodium bicarbonate along with lukewarm water, and irrigating the nose with nasal saline douches will help to relieve, to get rid of the mucus from the nose and cavities. And antihistamines usually will help, like cetirizine, levocetirizine, loratadine, fexofenadine, and nowadays we are having this belastin. Like that, there are so many antihistamines available, and these things they will dry up the nose and reduce the cold. And other symptoms, steam inhalation may help to some extent, and the nasal saline nasal irrigation. And if the symptoms continue to give more symptoms like thick green yellow nasal discharge, then the patients will need a course of antibiotics, usually 7 to 10 days for sinusitis, usually amoxiclav or quinolones or macrolides. These are the 3 groups of antibiotics are generally given for sinusitis. If it is a continuing problem and if it is lasting more than a week, then the patients also need antibiotics. Decongestants locally may help to some extent. The oral decongestants are normally avoided because of the side effects of dryness, constipation and palpitation. Topical decongestants like oxymetazoline in the nose, nasal sprays will help to relieve the nasal obstruction for about 12 hours. You may have to repeat twice, and also corticosteroidal nasal sprays are advised to get relief from the acute nasal symptoms.